So now we're going to introduce one of those clinical leaders that Natalie just spoke about, and we have Megan Worthy and Natasha Wood, and they're going to talk about their Beehive initiative. Welcome.
Hi everyone, and thanks for the opportunity to speak today. I'm Megan Worthy, and presenting alongside me is Natasha Wood. Together, we'd like to introduce the Beehive, a consumer-focused falls prevention model designed to improve communication at the exact moments our patients' care is most vulnerable. The Beehive actually started with something quite small. A family once described us as busy little bees. And honestly, they're not wrong. We are busy. But what stuck with me was this: if patients and visitors don't feel comfortable asking for help, that's where risk begins. We started noticing missed opportunities for communication between staff and visitors, increased risk when patients hesitated to ask for help, and then attempted to mobilise when they were in pain, fatigued, or more confused. And falls prevention sitting with staff, typically nurses, instead of being shared. When you layer that with single rooms, reduced passive visibility, long corridors, and a high prevalence of cognitive impairment, risk becomes less obvious and easier to miss. Not long after I took the idea to my mum, as just a simple thought at the time, how could we better involve families in those key transition moments? Within a week or two, we had a patient fall. They were known to be extremely high risk. We had all the right strategies in place to maximise that risk, to minimise the risk of falling. But what we missed was that moment when their visitor left. They became unsettled, mobilised alone, and sustained a serious injury. That incident led to a Harm Score 2 review, and what came out of it wasn't a need for more equipment or more resources. It was a gap in communication. The Beehive was endorsed from that review as a way to capture the moment when somebody goes from supported to suddenly alone. And that's where the Beehive really began, thinking of our hospital ward environment as a hive, where our patients are the main bee, all clinical staff as the worker bees, and visitors as the support bees. We are all working together to build something simple, not to add more tasks. This is a shared system where risk is visible, safety is shared, and action happens at the right time. So what does the Beehive actually look like? It all began with our Hive Rules poster at the bedside. They're bright, clear, and hard to ignore. But more importantly, they start a conversation. They guide families on how they can help, turning something that used to feel clinical and hidden into something visible and shared. Built into that is a safety checklist. These aren't new tasks. They're the things we're already doing every day, every shift. But the Beehive helps us do them at the right moment, and it gives families permission to be a part of that. To notice things, to act, or simply to let us know. This is where it really comes together, the honey for our hive. When a visitor leaves, they hand over the patient's individual buzz card. They are encouraged to hand it to any member of staff, nurses, allied health, admin, or medical officers, whoever's around, really. It's such a small action, but it carries a really important message. This patient is alone and might need you now. It prompts us to return to the bedside and replace their card. We check in, reassess, and make sure everything is safe. It's not another task, it's a cue. And what it captures is one of the highest risk moments we often miss, that quiet transition from supported to alone. To keep our messages alive, we reinforced it with simple supports. They are the Busy Bee reminder cards and a clear, easy-to-read welcome guide. So families don't just hear the message once, they see it, feel it, and become a part of it. When we look at the data from Fig Tree Transitional Care, it's really encouraging to see the positive outcomes for the ward's limited operational time. We saw a 14% reduction in total number of falls and also a 30% reduction in the harm from falls. What the numbers don't fully show is a shift on the floor. More proactive conversations leading to earlier escalation, visitors speaking up. That's where the real change happened. And what families told us really stuck. I felt like I was helping. I felt included and I felt reassured. That sense of reassurance, knowing someone will check on their loved one when they leave, that really mattered. And interestingly, the buzz card often opened the door to quick conversations, a little handover moment where families shared concerns we might not have otherwise heard. From a staff perspective, it felt like a shift, like we suddenly had extra eyes and ears without adding to our workload. That sense of shared awareness helped us prioritise care more safely. And essentially, isn't that the balance we're all trying to find? Better safety without more burden? The most exciting aspect is watching the hive grow, from one little aged care ward to gaining real traction across the Illawarra district. It's highlighted that when something is simple, practical, and adds a bit of colour to those very white hospital walls, people lean into it. We're seeing strong engagement from teams, not because they have to, but because they want to. And that's where real change starts. And that momentum has been developing at Bulli. Tash has really taken the Beehive and driven it forward, not only on her home ward, but across the whole Bulli facility. She's building strong engagement and seeing positive results. So I'll hand over to Tash, who'll take you through what it looks like in practice and where it's heading. Thank you.
Hi, so I'm Tash, when I'm not trying to avoid a panic attack on stage. I'm a clinical nurse specialist and I have the privilege of working in palliative, aged and rehabilitation at Bulli Hospital. I first heard Megan talk about the Beehive in our falls community of practice and I just absolutely fell in love with the program. I thought it sounded amazing and it was exactly what we needed at Bulli. So my ward has a similar patient cohort to Megan's with 2 very, very long corridors and 30 single rooms. So I can see everyone's hearts palpitating at the thought of that. Now, I might have used a little bit of AI in this picture here, but honestly, sometimes the corridors really do feel that long. So we soft launched the Beehive in mid-November last year and started implementing it on the ward on the 1st of December. Now, I'm not going to lie, getting buy-in isn't easy. Okay, we had a lot of changes on our ward and the last thing that staff want is an over-enthusiastic colleague with a bee in their bonnet waiting to do more changes. So to take away the sting, there's going to be a lot of puns, okay? So to take away the sting, the goal was to keep it simple and reassure everyone that it really is going to be no more work. Because in its essence, the Beehive is just reinforcing what we should already be doing, and that's collaboration, communication, and being proactive in preventing falls. Now, the beauty of the Beehive is that even without full hive activity, the results have been really promising. So these are our falls results for 2025 through to the end of March. Now, at first I was a little bit disappointed because although I can see the numbers are trending down, I'm a bit of an overachiever and I wanted absolutely 0 falls. But what the numbers don't tell you are the reduction in the type of falls that we were having. And this got me buzzing. So as you can see, from January this year, there has been a real significant reduction of falls in confused patients who are restless or needed toileting. Thank you. And also falls in bathrooms and sliding out of chairs. So in these statistics, I'd like to point out that 8 out of these 16 falls were from only 2 patients. These 2 patients were in their 30s to 40s, were independent with an age and had capacity. So unfortunately, even with education and support, they still made some risky decisions that caused them to fall, and there really wasn't much we could do. To the next one, thank you. So when we look at our 2025 falls by time band, we can see that 60% of our falls were during the 8 a.m. to 8 p.m. visiting hours. And we also had spikes at 2 a.m., 10 to 11 a.m., and 4 to 5 p.m. So in 2026, our falls during visiting hours dropped by about 15%. So in these numbers, it's really important to note that of those 7 falls during this time, 5 were by the 2 lovely independent risk-taking patients with capacity. 1 fall was a suspected seizure, and the other fall was a patient walking back from the courtyard, and unfortunately they clipped their toe on the weather strip. Thanks. So now as teamwork makes the dream work, or as we like to say, you can catch more bees with honey, we held a little Beehive roadshow across Beehive Hospital during Falls Week, and this included all of our inpatient wards and our lovely allied health team. So we're very excited to say that through the support of the ISLHD executives, Beehive management and staff, and the little honey pots that we had donated by Don the Honeyman to sweeten the deal, the Beehive is now set to launch across all Beehive wards this month. Now, it's only early days, and we can't say for sure that the Beehive can take all the credit, but what we can say for sure is Beehive has opened up conversations, increased awareness, improved collaboration, and made falls everyone's business. And the best thing is, the Beehive is so simple, even little bees can use it. Thank you.
Questions with the QR code if they want.
Okay, wonderful. Well, they've even given you a QR option up there, or it's just gone. But if you want to ask them any questions after the session, thank you. Technology, so if you want to ask them or get in contact with them, there's a QR code where you can contact them directly. But are there any, we've got time for some questions if there's any. It's not to be, so you get to go.
To be or not to be?
If you can't beat them, join them, eh? All right, thank you, girls. That was wonderful.